massage, acupressure, any type of modality where we encourage blood flow into the tissues is going to provide pain relief and also improve mobility. Good morning. I'm Dr. Ruth Roberts, the original holistic pet health coach. And with me today is Jenny Collins, one of our certified holistic pet health coaches and the proprietor at barkingdog.com or barkingbetter.com, excuse me. So, Jenny, welcome. I am so glad you're here with us today. You have some really interesting perspectives to share, and especially the really important one is how to keep your furry friend moving better, how to prevent injuries and all of those good things. Because if we can prevent things from happening, it's much better than having to fix them once they've happened. So welcome.
Thank you so much for having me. And mobility is such an issue that probably every dog owner has to face eventually, either because of injury or because of aging. It's a natural process. Or if you're like me, ending up with a puppy who has an issue being born with. And it's just when you have a diagnosis, the Western approach it gives you basically two options, in my experience: surgery and pain medication. But that's basically it. And this was part of the reason why I joined your program, because I thought there must be so much more to it. and there really is.
Right on. And one of the things that I think really was an eye opener for you was understanding some of these traditional Chinese veterinary medicine concepts. So, how did that start to change what you were doing to support pets?
First of all, I just want to also point out that just because we are holistic coaches, that we are absolutely not against the conventional medicine or veterinary medicine in this case, because I think people are always like, oh, we're doing something woohoo, but it should be in combination. So we need the Western medicine to have a diagnosis. And then with what started with me, it's a young puppy. Why does a young dog has such issues? That doesn't seem right. And especially it's not a dog that is going to be a huge dog. It's not a German Shepherd or a Labrador that is prone to have arthritis or hip dysplasia. I'm talking about a 16-pound 21 breed mix. I dove into it and it made so much more sense because the TCVM is focusing on the whole dog in front of you or the person, depending on the tradition. They see that there's an underlying issue and mobility issues. Everyone probably has experienced themselves. It's raining and suddenly your knee is hurting. So this is all that can be led to traditional medicine, which is ancient, but it's still relevant up to today. Yeah, and when you know how the traditional Chinese medicine views the body, the connection is that in their point of view, the muscles belong to the spleen, for instance, or the kidneys are connected with the bones and the joints. So hip dysplasia, which is a joint issue, a joint disease basically, has underlying cause in the kidneys. And this is where my light bulb went up. Oh my God. So if there's something going on there, maybe I can support the kidneys. Maybe there's some issues.
And so, when you started doing that with your own dog, what happened?
Oh my gosh, she's doing so much better. I started to notice when we got her when she was 9 weeks old. And I heard the popping sound. And it took 4 months before she was diagnosed, and not really properly because she was not sedated for an x-ray. So when I started to support her liver, I noticed, and her kidneys, I noticed that she's more agile in general. She's doing better. You can see that it's a whole thing of what I did. But overall, she improved probably right now by 85% with
And that's amazing. So, no surgery required, maybe some pain medicines to start with to get her comfortable, and then able to wean off and support with other things,
not even pain
right?
medicine. We dodged
Amazing.
FAO surgery twice. So this is the thing: when you have a diagnosis, there's only the surgery option, which is a salvage surgery of removing the femur head, FHO surgery, or total hip replacement, which is more for bigger dogs, eventually an option, which costs a fortune.
Yeah.
It's a long recovery, and you don't even know how it's going to be if you don't keep up with exercises afterwards. So she was scheduled to have FHO twice, based solely on an X-ray and a 5-minute vet visit. Like, yeah, we can do it. She's small enough to do FHO. And she was going to be spayed at the same time, too, at 9 months at this point. So luckily, we dodged it completely.
Right on. And so that's it. Most people don't realize that on the human side, the first thing they would do is tell you to strengthen the muscles that help support moving the leg. And there are a few, if you're lucky enough to have a rehab vet in your area, they will be able to help you with that. But many people can't afford to do the whole rehab program that may be $1,500, $2,000, $3,000. So it's so amazing to me that you basically looked at your dog, figured out the problem, and then you started incorporating many different techniques to support building the muscle, keeping her moving, keeping her mobile. And you now have a dog that is 85% better with no surgery and no
Pain medication.
pharmaceuticals. Yeah, no pharmaceuticals needed to keep her comfortable and moving.
The thing
So
is that TCBM offers so many options, and it starts with food. Food therapy is so important. And this is where we are supporting the liver and the kidneys, especially in this case. But it also, it starts in the gut, right? We want to keep inflammation down, because inflammation is ultimately what leads to us people and animals having pain and flare-ups and arthritis eventually. So we want to prevent this. And this is the whole point of what we are doing, is prevention. And what I learned in your class, especially, is using Chinese formulas, using supplements, and the most important thing, fresh food. Like, cook for them, and adding veggies like brassica, leafy greens for the kidneys and the liver, and omega-3 fatty acids, all that is nourishing for the brain. And ultimately, what it comes down to, we want to have a nice moving blood circulation to not get to a point where those diseases develop. And it's just not mobility issues in this case, of course.
Right on. And that was the cool thing. When I started studying, I started Chinese medicine first and then functional medicine. Both systems of medicine agree. If you're sitting, you become stagnant and things start to hurt because all of this yucky stuff accumulates. But what you said is just so profound. We can do 27 different supplements, but it sounds like you were able to come up with the diet that worked for your dog. And then on top of that, adding in things to help prevent the stagnation, the inflammation that's going to create the pain and discomfort. So that's perfect, right? That's what we all want. So I'm sorry, no. And you mentioned some of this already. In what ways did, when you were starting to learn Chinese medicine and supporting the kidneys, and in Chinese medicine, the organs are always capitalized when we're referring to the TCBM equivalent. But how did you learn the importance of supporting kidney function and what addressed, and then addressing the mobility issues your dog was experiencing?
Mostly because of your course, it was such an eye-opener. And what I really liked is that you first explained the Western perspective of it, and then went into traditional and Chinese medicine, or functional medicine. So this was like, oh my God, the underlying cause, it's all connected. So it was just, when a dog starts to limp, it's a sign of pain. And do you really want to give pain medication, which in people also affect the liver and the gut? If you take an antibiotic, what is the first thing you should do? Add a probiotic to not mess up your whole system. And this is something that we have to consider with our pets too. So when the blood doesn't keep moving, and moving is also because of motion. Motion is lotion. And what you just said before about physical therapy and exercises, this is something that we have been doing. I take you 2 hours away from here, one trip every week now, to do on a water treadmill, etc. But there are simple exercises that your dog can do, like stretching is really important, or just do a sit and stand with your dog to strengthen the hind legs. Because the older they get, the more the muscles begin to waste and you got atrophy. And in my experience with my senior dog Penny, who put me on this path before, I made the mistake to go, oh, she has those hip issues. Why do I want to make her sit and put more strain on it? So I just let her be. But it's a mistake, because you really have to the dog's ability, of course. but you have to keep them moving. Gentle, you can do prom exercises, which is passive range of motion. You can strengthen their neck, and very important, massages and acupuncture if you can do it, or have someone who can do it.
Exactly. And that's the thing. I think if you understand where some of those acupuncture points are, then you, the pet parent, can do acupressure at home. And maybe it's not the same effect, but you can see significant improvement. And that's
Yeah.
part of why doing things like tuina can be super helpful, because especially that rolling technique, you're rolling the skin all the way from the back to the shoulders. And what
Mhm.
you're doing is stimulating every point along the bladder channel so that the whole body starts to relax. Plus, you're loosening up the fascia over the top of the back so that there's more mobility and flexibility. I think that is something that's starting to come to Chinese medicine or to veterinary medicine in terms of supporting pets with arthritis, but massage, acupressure, any type of modality where we encourage blood flow into the tissues is going to provide pain relief and also improve mobility.
Right.
So that's totally important. So and so this has really become a thing that you focus on for a lot of people, is helping them understand how to improve mobility.
Mhm.
And I love what you said about the doing the sit stand to your dog's ability. So for an older dog that's 20 or 16 or 14, you don't want to start off with 20 reps. You want to do two.
Exactly.
Yeah.
And
Yeah. No. So with your older dog, what are some of the things that you did to help her enjoy more mobility?
I wished I had the knowledge that I have thanks to you now a year ago, or 1.5 years ago, because she was being put on Deramax and gabapentin, and at the end trazodone. And I have to say, gabapentin worked really well for her. And she was a rescue, and we only noticed or found out later that she was hit by a car, and her hip
Mm,
was broken. And because she was a puppy, my backyard breeder, mangy, it was awful. Also full of tumors. So she had a bad outcome. And we got 3.5 years out of it. And they said probably she wouldn't make 3 months. So that was really good. But the gabapentin, which helped, I think also causes, I'm not sure about it, but I think it causes neurological issues. So what I didn't do enough was not supporting her kidneys, because the kidneys, they get rid of the toxins. And this is really important to support. I did it to some extent, but I could have done so much more, just starting with the food and correct supplements. I use supplements, but not enough, or not the right ones.
yeah. And I think it's what you're saying is absolutely correct. All of these medications can have their place, but if we rely on them as the sole method of supporting it's we can't have as good outcomes. But I agree, and I think gabapentin, most of its issue is that it does help with the nerve, with the pain windup, but it can come at the cost of pretty significant sedation.
Right.
So if you had it all over to do again with an older dog, where would you start with a pup? If you had a
Well,
client coming to you as a coach?
with Penny, I also incorporated acupuncture at this point and cold laser therapy. But if it was a dog I would not know before, first I would like, of course, the history and what he's on, what diet he's on. If it's kibble, which is mostly common here in the US, unfortunately, it's high carb. So we want to get away from that because it's high inflammatory. So fresh food is the first thing to do. Also, it's a simple thing that people don't really think about. Check the nails of your dog. Are they long? Cut them, trim the nails, and also the hair between the toe pads, because what you want the dog to have traction. And because traction prevents injury, slipping, falls, etc. So this is the first thing, that it's just environmental stuff that you have to consider. And also provide enough, like an orthopedic dog for a senior dog. And again, start with gentle massaging, because what it also does is it gives you a bonding experience with your pet. Put the phone away, turn off the TV, just massage your dog. Now my boy is almost 12, and I'm doing it all the time, and he doesn't let go of me. He's sitting next to me as much as he can because I'm massaging him constantly. It gets the blood moving, and it's just simple things. And I would also do a pet personality test with a new client to see which is basically the basic constitution of your pet. It gives you insights of the character traits and potential imbalance in the future. So this is where we can start, because you can see where you have to, or where you can support certain things. Yeah, and it's really important to have a history. Does it start out later in life? Was there an accident, trauma maybe that happened? Or was it something that happened as a puppy? And by the way, this is something that was the real eye-opener when I got my puppy Sunny. She was the smallest of the litter, and I just learned that everyone is born what we call kidney jing, which is the life essence of someone. And the runt often can be born with a kidney jing, which is
Come here. I know she's so ferocious. She sees somebody outside. She had to just curb
oh,
it.
there's an older lady. Oh,
Yeah. She's definitely an older lady. Yeah.
oh, she's sweet.
And that's exactly right. We don't have that concept in Western medicine of the fact that dog, and you'll have to pardon the very southern expression, but if the dog comes out of the box wrong, yes, exactly, Audrey, then that dog is going to be prone to having problems later in life. And so we need to really be protective of their being or their essence. And one way to do that is to feed really well, so it suits that dog's ability to digest. And then we can create postnatal jing and help
Mhm.
that dog lead a longer, happier life. Right on.
That's the goal.
Yeah. It's yeah. Yeah, she's very ferocious with her two teeth. So those are just critical understandings. And sometimes it takes a completely different perspective to help us start looking at other ways to support ourselves, support our pets. But the massage component, I think, is so critical, because if that dog has been sitting around, oh golly, my back hurts, and they're tensed up all the time, everything's going to become uncomfortable because those
Yeah.
tissues get contracted down.
The
Awesome.
other thing I noticed with Sunny, she was, because the first, I think it was about 9 months before we saw the rehab, she was almost bent. She had a cat back, very crouched, and her pelvis was so tucked in, and her shoulders have been overdeveloped basically because she was compensating for it. So it's really important to have flexibility, to not create this tenseness in the body and tightness, because it will affect elbows and knees, and then you have a secondary problem.
Exactly. And that's part of what, Hayo's at least 12, maybe she's 15, but one of her front legs was broken. And so as a result, it's almost an inch shorter than the other leg. So you can imagine having that chronic twist with every step has led to disc disc disease because of the impact on there. So one of the most important things we do for her every day is she comes and gets her morning massage.
Mm-hmm.
And we'll see her straighten up and she's able to shake it off and walk a little more normally. But if we know there's an issue, we have to be really proactive about supporting the tissues around it and understanding a little bit more about the mechanics of the body too.
Does Hayo get chiropractic too?
She does not. And again, that's because of our traveling lifestyle. We're rarely in one place long enough. But what we do, and she does not think she should have acupuncture needles. So what I'm doing is doing a lot of massage, helping to adjust her gently just by gentle rotation and shaking. And then we'll do massage therapy along all of the places that are stiff, and then acupressure of
Yeah.
the points. And that seems to keep her moving pretty well.
And do you also use the PEMF pad?
That's exactly what this is, our one here in Mexico, but that has been a critical tool for her
Yeah, for us too.
because it has really, really, I mean, for both her anxiety level and the discomfort, this is a total game changer for her because she can sit on it as long as she wants or doesn't want. But honestly, wherever we are, we put the mat on the sofa and that's her spot
Oh,
for as long as we're in that place. Yeah.
yeah. We have one too, and we have 3 dogs, and it's almost always taken by some of them.
Yeah. Yeah. And that's the cool thing. When you can leave it on for a long period of time, then the crew shifts through there.
Yeah.
So, yeah. And that's amazing. So, I mean, you're doing all these things, you're starting to see how can this may be a problem later, then how can we prevent that from becoming such a problem? And I think that's such a key thing to make sure that we're being more proactive than reactive.
Exactly. And I would always advise get a second opinion if you got a diagnosis like this. Don't just get treated because of an x-ray, because what you really need to find is a good rehab vet. We travel 2 hours to find a good one, but who assesses the dog in front of you, who is testing the mobility, the flexibility. And if it's a young dog, there's so much you can do. And also, if is the dog in pain or not, because you really don't want your dog on pain medication all its life. And if so, there are like natural options that you can use. When Sunny is sore, I give her arnica or use an essential oil or CBD, which is a great help. So there are more natural ways to keep inflammation at bay and, of course, the pain.
Exactly. And I think Stathia was asking about some of the better supplements. So you went through a really quick rundown, but I think what's important too is accidents happen. And so if you have these things available in your house, then you can start using them immediately if something were to happen. Or if, for instance, with Hayo, periodically she might do something crazy, jump off of a sofa and not land very well. So
Yeah.
having that arnica available, having the CBD available so that you can get the discomfort under control really goes a long way to preventing that weekend of discomfort until you can get to the vet, and then you've got to use steroidal drugs or some other medication
Right.
to get the pain under control. So right on.
And even
So,
then,
and you mentioned,
pain
I'm sorry.
medication. Sorry,
Yeah,
even when you get the pain medication for a while, you still need to support the body even more.
exactly. And for her, we met meloxicam, which is a non-steroidal drug, is something we travel with because periodically the other things aren't quite enough. One, maybe 2 doses of that, and she's back to good. So we may use that once a month or every 2 to 3 months, just depending. But I think arnica, as you suggested, is fantastic. CBD is fantastic. What kind of, and then what are some of the other things that you're using to support painful pets?
I would also use your product Arthropause. This is a good thing to do. And omega-3 fatties, omega-3 and 6 actually.
Yeah,
Um,
because sixes are essential, but we're trying, yeah, but threes are going to be the more, yeah, exactly.
and
More
I would
anti-inflammatory.
yeah,
Yeah.
sorry. Yeah, and then there are things like turmeric or quercetin even. And for liver support, I always use milk thistle. This is just the
Agreed.
easy to incorporate. They tolerate it well. I don't think there's a
And
downside.
no, I don't think so either. And so all of these things, mostly you can just put in the bowl, then they disappear, right?
Yeah, it's easy. It's so much easier than giving them a pill that tastes really bitter. Oh, and also I use a Chinese formula, Rehmannia Assist Kidney. And I think, especially with a young dog, they can be on it for a long time. And I think they should be.
Agreed. And especially for a dog that in your dog situation where essentially she's born Jing deficient. And we know the kidneys store Jing. And so if the in Chinese medicine, and so if we support the kidneys long term, then we have a much better chance of preventing really yucky stuff from happening. So all wonderful suggestions. Cool. Let's do this. Let's jump over to our circle group. And yeah, so Rehmannia Assist Kidney Study is the way to go. So let's jump over here. So we have many of you are on our free Facebook group called Holistic Pet Health. And that is a great place to be to get some amazing information. In Circle, this is a private community. And so both groups are supported by coaches. Right now we're up to almost 1,360 people here in the Circle group. One of the benefits is that we've got the holistic pet health protocols here, and then the kidney health course and the mini gut health course, and then some really cool recipes, some downloads about when to spay and neuter, vaccinations, all of that stuff. So you have access to all of this really awesome free information. And then this is where folks come in and introduce themselves. So imagine living in this house with these 5 Goldens that look really super chill. So Tanya, welcome. Great to see you. She's in human health care and sounds like she's doing everything she can to keep her girls happy. And Donna, very nice to meet you. So she's done a lot of different certifications, including Equine Gestalt, to help horses help humans heal, which is amazing. That is an amazing technique. And she's discovered that resiliency and the ability to help women move through grief and trauma. So amazing and welcome. Glad to see you here. And look at those guys. Beautiful Pennsylvania. Right on. And then Carrie and the house kitties, the house lions, as you call them. So glad to see you here, Neil. And then we'll jump over here to positive updates, which is where we'll share information about what we've got going on and some of the places where I'll be speaking. Actually, I'm heading to Scottsdale Friday to join the BK Pets at Fetching Dog, which is a beautiful boutique pet store owned by one of our fellow coaches, Becky Scott. So that'll be a ball. I hope I can see Sandy there and maybe Shannon as well. And then we have another event at the Lone Star Pet out in Cave Creek. I think that's correct. So that's going to be a bunch of fun this weekend. And then this is where the magic happens. So we've got some questions in here. So AMC's asking, she's got a small dog that's been on crock pet diet for several months, and she started getting some brown staining. So what do you think about that, Jenny? Have you had any experience with that?
No, but I would ask her first if she has done a Glacier's peak test and to see if there's any intolerances that the dog can handle. And I would also like to see what kind of recipe she is actually following.
Exactly.
If there's too much kelp or something in there, iodine.
Yeah, or the other thing would be maybe this dog, so the recipe, sort of base recipe, includes grains as well as beans, and it may be that the one of those is not working well for her. So I think that's exactly it. Working with a coach, doing a Glacier Peaks holistic test, then we can figure out if there are food sensitivities and adjust the diet so that it best serves her. And then somebody's having difficulty with cooking. And then Catherine's asking about dogs who have suspected pancreatitis. And I think what's happening is if a dog goes in with some vomiting and diarrhea, most of the time they get told that the dog has pancreatitis, but sometimes it isn't. And it's really interesting. I learned over the weekend that there is non-alcoholic fatty liver disease in humans, and we recognize that in dogs. But there's also non-alcoholic fatty pancreatic disease. And I think this is where a lot of this pancreatitis is coming from. And really what's happening is these guys are eating highly processed carbs, and that is creating more inflammation in the body. They know this on the human side. The people that eat the standard American diet with lots of processed carbs, lots of high glycemic impact foods, they're the ones that are at risk for developing pancreatitis. And I think this is the mechanism that's going on with our pets when they're getting diagnosed with pancreatitis, or maybe probably pancreatitis. So that's
also how heavy the dog is. Isn't it in pancreatitis? Because
sometimes, yeah, obesity, exactly. So anything that's going to increase inflammation in those pets. So being overweight, because the fat stores all of these inflammatory molecules, along with all the other environmental toxins that scare the bejeebers out of us. So as that gets broken down and released, and it's not so much as they lose weight, but as they make more fat, that fat gets more compressed, which forces these chemicals out into circulation. So all of those things will end up creating any itis. So itis literally means inflammation. So when we say pancreatitis, hepatitis, gastritis, arthritis, all of those things mean inflammation. So that's critical to know. Have you experienced this with dogs with pancreatitis? Have you had any folks that you've supported through that?
Only online on Facebook because of the whole kibble food scandal that's going around. and that they suggest stop the kibble. And home cooked is just the best, ideally, because you know what's in it, right? And you can really cater to your pet. And this is important because also, if you have a consultation, I would always start also with the pet personality, because you know what kind of animal you're dealing with. And if you have a dog that's overheating quickly, like a fire personality, you want to cool it down. So it's important to choose the right protein for it, to have a balanced dog, because it also, everything can also manifest in behavioral issues at some point: anxiety, aggression, fear. So it's a cycle. and
And it's all interrelated. That's the other thing too. We try to say, oh, this dog has behavioral issues and just treat for that instead of looking at the whole pet, right?
yeah, maybe it's in pain, acting up.
Yeah. Yeah, because it hurts. Chronic pain, I got to tell you, makes you really grouchy and miserable to be around. Um,
So
yeah, cool. So, yeah, I think that's it. I mean, what the ultimate thing is that in conventional medicine, we've been trained, and we, meaning both the healthcare providers and patients, have been trained to look at the issue in isolation from the body. But I think that's the grievous error. If we don't look at the problem and how it relates to the functioning of the rest of the body, then our ability to provide more help really, really goes away. I think you've got this dialed in very tightly in terms of how to use that to support pet parents.
yeah, and this is
So,
what we're trying to do, because it's, you don't want them to be, oh my God, I'm trying this and this, but what is ultimately working? So if you go to someone who knows what is working and who starts you off with maybe 3 things, then you're off to a good start. And this is what we,
exactly.
yeah,
Yeah,
it's,
exactly. Please.
no, it's about education. It's about, like, what we want to do is educate the pet parent how to properly care, so that they don't feel left alone, that they don't have to deal with something and are suddenly overwhelmed. And don't go to Google and type in, and the first thing that comes up is usually cancer. It's a fear that we're trying to get out of their system, and also to bridge a gap. Because I'm not, it's like the thing, oh my, you're holistic, so you're an anti-vaxxer. No, I'm not. I'm informed. That's a big difference. And I want you to be informed, to make informed decision for your pet that is tailored to your pet. Because what may work for Hayo may not work for Sunny. Just
That's
what,
so true. And that's it. And that's kind of part of the fault of the system. It's all one size fits all instead of, no, we must personalize it to each individual pet and
right,
figure out, like, we may have a templated plan, but then we need to adjust that template to support that pet in front of us.
exactly.
But it's just so critical. And I think that's the thing, is that there's so much I'm pro this or anti this, instead of looking at life really was terrible when parvo first came out in the 70s. It and distemper in the 50s would go through whole towns of dogs and kill them. But does that mean we need to vaccinate every year because of that?
Exactly.
Absolutely not.
No,
So I think that's exactly it, is informing yourself, using incidence maps to see, is this a problem in my area? Is it not a problem? It's just so critical, and really finding a reliable source. So again, Jenny is one of our certified holistic pet health coaches. She's graduated the program, and that is her job, is to help you sort through what makes sense for your dog, for your living situation, and what does not.
and
And
there's,
there,
yeah,
yeah,
there's
yeah,
one big thing that's also debatable, is the spaying. And especially with mobility issue, it's really critical to not spay them young or neuter them young. They need their hormones, especially huge dogs. And we got Sunny off the spay twice, and she's in heat right now. It's not fun, but it's okay. She's almost 18 months today, actually. And I try to keep her intact as much as I can, as long as I can. Or if I can't do it, then I would aim for 5 years, spay her at 5 years, and maybe do an ovary sparing. There are so many options. And this is something that we need to put out there.
right on. And that's something I'm spending a terrific amount of time talking about, because really, I believe this is the biggest cause of this epidemic of chronic disease and cancer we're seeing in dogs and cats. I had the opportunity to interview Dr. Peter Tobias, who many of you know,
Yeah.
And he was telling me the story about his dog, Pax, that was beautiful, healthy, vibrant. Dr. Tobias felt like he had it all completely dialed in, and Pax's health was just incredible. He neutered Pax, and then shortly after that, he noticed that his hair coat wasn't looking as good. He wasn't feeling as well. He didn't have as much energy. And finally, he was hiking with some friends. Pax bailed out of the truck and collapsed.
Wow.
So here is this 2.5-year-old dog, and Dr. Tobias is thinking, what in the heck is going on? And he started putting two and two together and ended up finally talking with Dr. Michelle Kutzler, who did the research on how spaying and neutering impacts our pets, got Pax the supralorin implant, which is not available in the US except for ferrets, but it reduces the production of luteinizing hormone, which is what we think is creating this spay-neuter syndrome. And within a matter of weeks, he started to see his Pax come back to his full health. So I think that is, and so he's telling me this, and I'm like, yeah, you just treated spay-neuter syndrome. But that's the thing, is we haven't named it, and so we don't know what we're dealing with. And I think that's really critical as well. If you can name something, then you can begin to understand it and know how to approach it. So exactly, ovary sparing spay, vasectomies, delaying spaying and neutering. And then supralorin is available in the US for ferrets. So you can ask your veterinarian, hey, I know this is not licensed for use in dogs and cats, but I do understand that it is possible to use it off label. Is that something you'd be willing to help me with? And what this is, an implant of a hormone blocker for gonadotropin releasing hormone. And so if we can save ourselves the pain of having an intact female dog in heat, but she keeps her ovaries and stays healthier, how much better is that?
Would you neuter a teenager? No.
No, exactly. And so we know in women, and this is the thing, we don't know, nobody's ever really looked at this. I think the first studies came out in 2013 from UC Davis in golden retrievers. There was a clear difference in the health of dogs that were not neutered or spayed and the dogs that were. And the incidence of cancer became rampant, hip and joint disease rampant, intact dogs. There were no golden retrievers with cruciate ruptures that were intact.
Wow.
Versus almost every, that's a huge problem for goldies, right? So Jay, yes, can I never spay your dog if she stays perfectly healthy? Yeah, there's a couple of things you do need to be cognizant of with intact pets. For female dogs, they can get a uterine infection called pyometra. I'm old enough to tell you that from back in the 90s, I saw maybe 2% of my patients develop a pyometra. The current estimates in the literature is somewhere around 10%. It is not fun if it happens because it is a life-threatening situation. The other thing is the female dogs will develop breast cancer. But if we look at the Italian dog cancer registry, where the cancer incidence in male dogs is 1.1%, and in female dogs 3.26%, versus 25% of all dogs in the United States, I will take the 3.26% in the female dogs over 25% any day.
And also breast cancer, I think, is much better to handle than osteosarcoma. Come on. That's
Amen. Amen to that. And so that's it. In breast cancer, 50% are benign.
Yep.
Of the other remaining 50% that are malignant, 25% stay put, 25% have the potential to metastasize. So again, I'll take that over osteosarcoma all day long.
They found this in Penny when they spayed her. She was also age unknown, probably like it varied between 7 and 12, depending on the vet. So it was a huge span. And when they spayed her, they found breast cancer. And they tested 2 of them benign, and they didn't want to adopt her out because she was so fragile and didn't make it long. And I just wanted to give her a good home. And ultimately, she did not die of cancer. She deteriorated because she developed sundowners. And she just was, or even a brain tumor, we didn't do an MRI, but she was circling and pacing. And this was then at the point where I said we had to let her go. But it was not the cancer. I supported the cancer, so with stuff. So I wasn't afraid of that, but the rest was deteriorating her.
Right on.
Yeah.
And I think that's really critical to know, is that many of these dogs will die with cancer,
Right.
but not of cancer. That's a huge thing to know. And Stephanie, to your point, how to safely get rid of fleas on the pet and the home without chemicals. Have you had this experience, Jenny? I think you're not in an area where you have so many fleas.
I
But
never experienced fleas. I had now 4 dogs in the last 5 years since I live in the States. None of them have fleas. They don't go to boarding facilities or groomers. And I'm not giving them tick and flea medications anymore. So they're off of it. I just spray them with natural stuff. They do have ticks, of course. Just yesterday, I picked 6 of them off. But I've never had fleas. And I think it's also, if your dog has a good immune system, in my experience, they either come or they don't. And
right on.
I don't know. I never had them.
And so you're in Wisconsin, am I remembering?
In Iowa, but soon in the
Iowa.
so we split
Oh,
times. But in neither state we had a flea
yeah.
or a flea problem. Ticks, yes, but not flea.
And so in the Southeast, it is a problem for sure. And so, Stephanie, to your point, yeah, so Florida are terrible. So and that's great that you're not having it, but another family member does. So that's where I would look at things like fleabusters.com. They have nematodes to treat the yard. They have products that you can put in the house to kill fleas that are completely non-toxic. And more importantly, they kill the flea eggs and larvae, which is 85% of the problem. And then you can use things like frequent bathing, and then essential oil sprays. Baltic amber collars are amazing because they are creating an electrostatic charge to help repel the fleas. There are 0 bug zone tags. There's a myriad of things. And then finally, if they're really bad, there is a medication called Capstar, which you can get at this point in Petco or PetSmart, that will take the fleas off of the dog for 24 hours. And sometimes several doses of that are required until some of these other things kick in terms of killing the eggs and larvae, because it takes about 3 weeks for the pupae of the fleas to hatch out and create more adult fleas. This is the one part of the flea life cycle we just can't get to. But there's a myriad of other options. So if you head over to our website, there's a blog on natural flea control. And then within the shop, there's Baltic amber collars as well. But yeah, in Florida, in the Southeast, it's a bear. It is an absolute bear. So it's important to do environmental control to get things under control. And then it won't be so bad for your family member after that. You're welcome.
So when you travel a lot between the EU and here, so do you bring products? Are you allowed to bring stuff from here to Europe or vice versa? Or do you get European stuff? What do you do?
So we have a kit that we take with us everywhere. So we have some Capstar, because if we walk into a flea nest, we want them off of her as quickly as possible. We will use the Baltic amber collars, and really that's all we've needed so far, because we're able to stay in drier climate places, and that helps me a lot. And if you get out of the high humidity, you also leave many of the fleas behind. But we have some 0 bug zone tags if we get into an area where there's a lot of ticks. In the EU, leishmaniasis is a big problem in ticks, which we don't have in the US too much. But it's Lyme disease on steroids. It's a really horrible disease. So we just travel prepared. What are we going to need in this environment? We have some heartworm prevention for her. I think we give her maybe 1 dose a year. It just depends on where our exposure risk is. And so I do what I say to everybody. I go and Google, all right, I'm going to be in Montenegro for 6 months. What's the incidence of heartworm? What's the incidence of fleas? What's the incidence of ticks? What do I need to be prepared of and aware of so that I'm able to protect her?
You're informed, yeah, and educated. That's
the
most important thing.
Exactly. Yeah. Every veterinarian wanting to give every dog leptospirosis. And if you Google the incidence of leptospirosis, it's bad in Texas. It's bad along the Mississippi River, but not much else. Jay, thank you for your interest in the course. So we have both a 4-month program and a 1-year program. And what I would suggest you do is reach out to my team at this email address, and they will get you some more information. But Jenny, what would you say about the certification course?
I loved it. It was the best thing that I have done last winter. I started in November, and I have to say I saw all of it when I dove deeper into holistic approaches, which is when I found you. And I was nervous about doing it because English is not my first language. I'm German. So I was like, oh my God, can I do it? But I was so intrigued and it sounded so good. And for me, it was okay, I have dogs that have issues. I need to face them somehow and then help other people. But ultimately, I think we all have this certain pet that puts on this holistic path. I think everyone has this kind of story. So I would definitely recommend this program. You can do it at your own pace. It's really well designed and you got a mentor and everything. So what I loved most about it was is still our Monday sessions with you and the other coaches. And even when I started the program and I was in the first session and Zoom call, at first I was like not intimidated, but it was, oh my God, everyone knows so much. And it was overwhelming in a good way because you pick up on so much and I still take notes every week. Oh, that's interesting. I can look into this because everyone has a certain area where they're really good at. And this is what it's really great. It's a bunch of people who are all on the same page and want the same, which is a healthy pet and basically spread the word that we can do something ourselves.
Exactly. And this has been the greatest honor of my career, is to create this program and to create this community where not only on the Zoom calls, but in our Circle platform, that's where the course lives. We have a very vibrant community where sometimes y'all are asking me questions and other coaches are chiming in with the answers before I ever get a chance to answer them. But even though we may all approach things a little differently, this person feeds raw, this person feeds cooked, we're still supporting each other. And I'm thinking that this dog may actually do better with raw. How would I start supporting that person to head in that direction? That's been just so amazing to see you all helping each other, helping explain different techniques. And we've got people in there with a wide variety of experiences. So it's been the world that I wanted to create, where we're helping and collaborating instead of saying, no, this is the way and this is wrong. Yeah, because there are all right ways. It's just you have to make sure that it's the right thing for that individual in front of you.
Exactly. Cool. And you have to work with a pet parent. Are they willing to cook? Are they willing to feed raw? I personally do a mix of everything. I feed raw and home cooked and freeze dried because it gives them a whole variety. So, and I do great with it. So
right
it's
on.
that we want to push a certain opinion. Certainly not. It's just you work with what the pet parent is willing to do and help guide them in the direction.
Right on. And Stuthi, I missed this question. This is exactly it. So for a dog that has been spayed or neutered, and male or female, testosterone replacement, it can be absolutely a game changer. And it does help to build muscle and improve strength. And the other thing that it's doing is shutting off LH production. So Dr. David Bieber with dogsterone.com is training veterinarians how to use testosterone therapy. So I think it's an excellent option. Cool. So y'all, that's what we've got time for today. Jenny, thank you so much for coming on. It's been fun and fascinating, and I think we got a lot of great info out there for folks. So until next week, we will see you then. Keep the questions coming. Jump over to Circle and go join that. Let me see if I can dump that in there real quick. If you haven't checked this community out, I think you're going to really enjoy it because, again, we're able to get you more support, and there we go, and get you different options. And plus, all of our amazing free downloads are available within that Circle community too. All right, cool. Y'all have a great week. We'll see you next week.
Thank you so much.